Good afternoon. Thanks for joining me today. My name is Dr. Laura Scott. I'm a physical therapist and pelvic health specialist here with Cornerstone Physical Therapy. And I'm delighted to be speaking with you today about urinary incontinence and how physical therapy can be an effective means of treatment for a variety of bladder problems. Cornerstone Physical Therapy is a locally owned and physical therapist-owned private practice in Asheville since 2008. We have 3 locations in the area to serve you, and I work out of the Arden Clinic, and we're a group of specialists offering a variety of conservative, meaning non-surgical and non-medication-based treatments to help you address some specialty areas, including pelvic health and pelvic rehabilitation. So today we're talking about the bladder, and we're talking about urinary incontinence. Incontinence is a big, scary word, but keep in mind that there's a spectrum of what may still be considered incontinence, from a little leak or a little drip to a full flood or a full amount. Anywhere along that spectrum, if your bladder is not doing what you want it to do when you want it to happen, physical therapy can help you. Urinary incontinence is very common. Over 50% of adult women may experience this at some point in their life. Whether you're one of my younger women who is still has a menstrual cycle but still hasn't given birth yet necessarily, certainly very common through the pregnancy and the postpartum experience, perimenopause, and even into postmenopause. But even my people without female parts, my male bodies, will experience urinary incontinence. 10 to around 30% or so of adult men may have problems pertaining to the bladder. Age can be a factor, pregnancy and birth history, but also in my people who have not given birth, a history of a lot of impact on the body, whether that's high impact sports or a lot of physical activity, maybe for a job description. These folks, having experienced a lot of pressure, may develop urinary incontinence. Smoking is a risk factor, smoking status, and of course body weight can be a risk factor in developing urinary incontinence. But you should know that all of these things can be overcome with good bladder and pelvic muscle training. So fear not, physical therapy is here to help you. We say that urinary incontinence is common but not normal, meaning it can be a natural part of our body's changes throughout the lifespan, but this is not something that you have to resign yourself to. This is not a problem that you have to accept just because you're a person with a female body. This is not simply just a part of being a mom, but this is treatable. You can develop control over your bladder without having to undergo surgery and without having to delve into medications that may have side effects that are uncomfortable for you. So know that bladder incontinence is common. Someone out there, we may not be talking about it, but we're experiencing it. But this is not something that you simply have to live with as part of life. This is not normal. We'll go through today in the program some of the different types of urinary incontinence and connect that with how physical therapy can be an appropriate and effective form of treatment to deal with these different types of bladder problems. As a general rule, we have several different types of incontinence: stress incontinence, urge incontinence, that's sometimes associated with frequency or leaking, for example, on the way to the bathroom. Mixed incontinence, meaning that you have a little bit of both. Lucky you. Functional incontinence, because of physical mobility difficulties, we can't get there or get to the toilet in time. And what's also called overflow incontinence, and we'll speak briefly about the type of male body forms of incontinence that can arise. But know that there are different types, and some of these may speak to you and say, oh yeah, that's what my bladder does. We'll start with the most common and not necessarily the easiest to deal with, but one of the more common, stress incontinence. And know that I'm not talking about stress because of an 80-hour work week, or stress of having the kids at home with you while you're trying to work at home. But this pertains to physical stress. This is the bladder that leaks with physical activity. Whether this is getting in and out of the car, coughing or sneezing or laughing, or running, jumping on the trampoline, doing jumping jacks. These are all symptoms that I hear described when we're talking about stress incontinence. And in this situation, there's more pressure on the posture, on the abdominal system, than the pelvic floor can handle. In general, the bladder works in this way. We can think about it as a balloon, and when it's empty, it's just hanging out, kind of loose like this. But as it fills with urine over the course of time, this is what happens. The bladder starts to fill. Now, the pelvic floor muscles are helping to keep that bladder and that urethra clamped. But now, let's say you go and you have a strong cough, or we're jumping up and down on the trampoline, and the strength of the floor muscles cannot overcome the pressure of that action. So we may sneeze, achoo, and we may lose urine, for example. So that's the basic explanation of how stress incontinence works. So this depends on how intense the activity may be. You may be someone that a cough or a sneeze, that's not really problematic, but as you begin to go on your run, maybe the first mile isn't a problem, but as you get to mile 3, you can start to feel that you're more leaky. And so that just is going to depend on the body and about how intense that pressure is on the system. We can have a small amount of leakage to maybe a full bladder loss if we really can't overcome that pressure. So the muscles and muscle training needs to be a good fit and the right match for the kind of activity that you're doing. Controlling the bladder for a cough is going to be different from controlling the bladder during a run. So this is the same idea, folks. You may find that someone has a bladder problem or may leak when they're going up and down stairs, going from a sitting to a standing motion, or something more like a running or a jumping, or whatever your preferred exercise routine is. But know that we need to get the muscles back talking to each other and in the right balance to help you do what you need to do successfully. So moving on to the type of incontinence that occurs with a strong urge. And in this situation, that bladder may be contracting, giving you that sense of, oh, I really have to go, but that's happening at the wrong time. It's sudden and it's strong. We're not talking, oh, I feel like I need to go empty my bladder, I can get to the bathroom in a few moments. It hits strong, and sometimes there's leakage with that urge. Often this will be associated with triggers, meaning every time I hear running water, I really have to go. Or very commonly, pulling in the driveway, getting the keys out of your purse or your backpack. those can be associated with the bladder says, oh yes, it's time to empty and it's time to go. Sometimes these folks will feel this frequently, and we develop this problem with feeling like I have to go every hour, every 30 minutes. Even though I just went to the bathroom, now I feel like I have to go again. That's called urinary frequency. Some people may have that sense of frequency, I have to go all the time, but may not necessarily be leaking. And that's a slightly different problem, but also one that can be overcome with physical therapy. And the overactive bladder concept goes along with this. You may have been diagnosed with overactive bladder, or, oh boy, that sounds a lot like me, my bladder is way too active. This is this idea that there's a frequent and strong urge to go to the bathroom. With urge incontinence, or with an overactive bladder syndrome, the bladder will be spasming, whether or not there's physical change in activity. So this is not pertaining to a cough, for example. I may be minding my own business, sitting in front of the computer at work. Bladder spasms or contracts and makes you feel like you have to go. To overcome urge incontinence, the muscle training is still very important because we need these muscles to control against a leak, just like with stress incontinence. But there's a powerful component of what I like to call mind over bladder that becomes involved, because this is also a nervous system problem. The bladder is giving you the wrong signal at the wrong time. So with some training to understand what normal bladder should look like, how to deal with those unwelcome urges, you can use your nervous system to calm down that constant signal. Mind over bladder or bladder retraining, habit training, or behavioral training is very effective in working with urge incontinence. So this is something that we have the opportunity to spend some time talking through in your physical therapy sessions. How to deal and how to react when I feel like I have to pee as soon as I put my key in the door. So these are called some of these habit training. It's very effective for urge incontinence. And of course, we're still going to be working with those pelvic floor muscles to control the leakage and to help to calm down that spasm or that contraction of the bladder. Moving on to my people with a prostate, we have some types of incontinence that can occur in the male. Certainly, stress incontinence can occur when the weakness of the pelvic floor muscles is part of the problem, and these are my folks that have tended to have some kind of a prostate cancer treatment. We lose that nice gland, which is a clamp in the male body around the urethra. Now those pelvic floor muscles have to be that much stronger to overcome the filling of the bladder. So these guys can certainly still experience stress incontinence. Even sometimes if the prostate is still present, but it's maybe enlarged, or pushing on the bladder. And then, even though the pelvic floor muscles may be good, there's that extra pressure on the bladder because of an enlarged prostate, and then we sneeze, and then we have some overflow, or it comes right out. So these are a couple of different ways that different prostate conditions can affect continence in the person with a male body. So we can often have a mixture here of dealing with bladder contraction at the wrong time, weakening of the pelvic floor muscles, all of which is effectively dealt with in the physical therapy setting. Another specific population that I'd like to mention are our postpartum new mothers. In the initial 12 weeks following giving birth, we still have a tremendous amount of body change that's going on. It's common to have bladder incontinence in this time because of the intensity of the experience of 40 weeks of gestation, the pressure, and some of the hormonal changes that can affect how the bladder is behaving. But then the intense experience of labor and delivery, even in the situation of cesarean birth, can create a different bladder in that postpartum period. We often see that some of this early incontinence in the postpartum time doesn't simply get better just with time. So I always want to encourage my new moms to consider postpartum rehab, abdominal rehab, pelvic floor muscle training, because this does not tend to just simply get better as a course of age. We see that a lot of women develop bladder problems in the postpartum period, and that's the beginning of habits and muscle conditions that just don't change over age. So this is a really important time to get support while you're adjusting to motherhood, carrying heavy car seats, a lot of bending over, while at the same time you're trying to recover your muscles. So you deserve some support in that time. So please reach out. We love working with our postpartum moms. But know that urinary incontinence in this time is common, but not normal. So again, a variety of reasons why your bladder may not do what you want it to do when you want it to do it, all of which are effectively treated with muscle training, habit training to recover the control of the lower body. Medications may commonly be recommended by your primary care provider. We know that not everyone can tolerate just any medication. There are side effects that may be involved, but the medication often doesn't address the issue of muscle weakness. So we really see the best results, even with an urge incontinence or overactive bladder situation, if we're combining physical therapy with your medication. We see that commonly borne out in the research about bladder incontinence. So know that a medication for your bladder may not be working because it's not really addressing the issue, which is the weakness of the muscles. Surgery is an option. Surgery should be considered your last option after pursuing a course of physical therapy for muscle rehab. Surgeries have their own risks. And again, even though we may have like a bladder tack, lifting of the bladder type of a surgery, if those muscles of the pelvic floor are not in good shape, these folks may still continue to have urinary incontinence. And that's very discouraging for some of my folks who may come in. They say they've had a bladder tack or a lift, but it didn't address the problem, which is still the leakage. Even if you're a great surgical candidate, maybe in this situation of a prolapsed bladder, for example, working with your muscles before the surgery or the pre-rehabilitation and or physical therapy after the event is going to give you the best possible outcome. So with physical therapy, we're addressing the source. We're addressing the mind over the bladder habits, understanding fluid management, these changes that you can make in your lifestyle, as well as the muscles themselves. We help people to avoid surgery completely, reduce or eliminate their medications, or improve the effectiveness of either one of those interventions, whether you're still going with the surgery or whether you continue to pursue using your medication. We know that physical therapy in the long run is a lower cost to the healthcare system, to your deductible, than a surgery, and we don't have any side effects. We'll talk a little more about the pelvic floor muscles, which I've referred to many times so far, but you may still have some questions about what those muscles really are and how they really work. The pelvic floor refers to a group of muscles that form a sling or a hammock or a diaphragm, even, between the bones where we sit. From the front to the back, we have pubic bone all the way back to your tailbone. And from side to side, the sitting bones, the bones that you can feel when you're sitting in a good posture in a chair. So these muscles are lifting up the bladder, the uterus, and my people with a uterus, and the rectum or the bowel. So the pelvic floor is part of what is keeping all of our organs in an appropriate and a lifted position. When we talk about pelvic floor muscle training, invariably you've heard the term Kegel or Kegel, and this gives us the exercise concept that these muscles need to both contract or squeeze as well as lift and pull up. We need this Kegel motion or this pelvic floor muscle squeeze and lift with all of our body movements, including a cough or a sneeze, right? But certainly with a run or going up and down stairs or any situation where your body is going through some pressure on the pelvic floor. Pelvic floor or the Kegel exercise will still not be effective if you're not working together with the rest of the big muscles of the core of the body. So truly, pelvic floor muscle training needs to be done in context and complementary with not only, let's say, the hips and hip muscles, but also the abdominal muscles from the front, attaching to the front of the pelvis, the diaphragm, the respiratory diaphragm, the muscles of your breathing, those will impact the pressure system, as well as the muscles, the deep muscles of the spine. All of these muscle groups working together, from the bottom with the pelvic floor, from the front with the abdominals, the sides meaning the hip, and the back of the body meaning the spine, all topped off with the respiratory diaphragm. We call this whole phenomenon the pelvic girdle. This gives us the best possible support to the bladder and the organs of the pelvic floor. Now, as a quick disclaimer, this is not the only thing that these muscles need to do. Not only do they need to squeeze and lift to provide the support, but the pelvic floor muscles also need to be able to relax and to lengthen. So if we're not being effective with our Kegels or our core training, we may start to develop some tightness in these muscles that can cause some other difficulties. So I want you to know that while it's important to have the squeeze and lift of the pelvic floor, we also need in our daily activities for these muscles to relax and open up. We need that for toileting, whether that's effectively emptying your bladder or effectively emptying your bowel, to receive penetration in the situation of gynecologic exams, tampons, or intercourse. These muscles need to relax for labor and delivery. They need to relax after surgery, particularly if there's any kind of pain. And we'll often see this even with our athletes, that these muscles may be so tight and overactive that we have like almost an overflow incontinence situation because of the pressure. So it's important to talk with a physical therapist about what you do with your body on a daily basis. What's the background, surgeries, pregnancy history, etc. Because you should know that the Kegel is not the right exercise for everyone. And we can help talk you through that and customize what you and your body needs. So for the bladder to do what we want it to do when we want it to happen, we not only need the strength, but also this sense of control. Can we relax when we need to relax and have stability or support when we need that? We call that coordination. And so that's a very important factor of pelvic floor muscle training. In the physical therapy setting, you should know that because each body is an individual, our job is to assess what is going to be the most effective for you in terms of that combination of relaxation versus Kegel muscle training. Our sessions with the physical therapist are one-on-one in a private room with a closed door, so that we have the amount of time and the comfort level for the patient to be able to fully discuss and fully treat this. We're doing muscle training together, of course, for strength, for relaxation, and both for coordination. And we have the opportunity to really delve into that habit training or those behaviors that can help the bladder to calm down. So in conclusion, I want you to know that you can be confident with your bladder at any part of the lifespan and at any point in your physical experience. That urinary difficulties and problems and leakage, this is common, but it's not normal. You deserve to be able to run if that's an activity that you enjoy, and you deserve to be able to jump on the trampoline with your children if that's your goal. And know that at any stage in your life that you can recover and benefit tremendously from pelvic floor physical therapy. You do not always need a physician referral to see a physical therapist. PT is a covered benefit by virtually every insurance provider. And pelvic health or pelvic rehab physical therapy, while it's a specialty, is still a physical therapy benefit with all insurance providers. So this is not a specialty area. If your insurance covers physical therapy, then you can come and have physical therapy for your bladder. And you'll have the advantage of an individual plan. So if you have questions about this and about whether or not PT is right for you, or you're ready to get started, you can call our office directly, speak with a new patient coordinator, and they will help figure out any insurance questions that you have and to verify that coverage if you have questions about using your insurance. So in this day and age, we want to conserve toilet paper. You have 3 options today to stop leaking and to do what you enjoy. Come on into the clinic, and we have clinic-based physical therapy. We also are able to perform telehealth and televisits, if that's more comfortable for you, or a hybrid model, and we can do a little bit of both. But I want you to know that we're here for you, and today can be your last day that you leak when you sneeze. Feel free to drop us a line in the comments below. Our marketing director, who's watching this program and monitoring our Facebook page, will be happy to get back with you, or just give us a call directly. Contact us through our website. Lots of ways to get in touch with Cornerstone Physical Therapy to start your program. If you have any questions that I can address for you right now, drop them in the comments below, and I'm happy to take a look. Looks like we don't have any questions or comments right now. We're here for you and look forward to helping you reach your goals. Thanks again for tuning in.